potato, Avéli, whatever you want to call it. Let's find out what it is. So this is the Avéli tool right here. All right, this is the only one that is FDA approved, by the way, to get rid of cellulite for good, okay? So what your provider is gonna do, a surgeon can do it, a PA can do it, an RN can also do it as well. So what they do is they make a small, very small, like if you can see this tip right here, it's really small, and they're gonna make a small incision, insert this in underneath the skin, in between the muscle. There's gonna be a Septa band that holds that skin down, and that's what gives you the peaks and valleys, the dimple, the cottage cheese, and it goes in there, they pull back, and it clips away at those bands. Those bands are gonna sit in there. They don't always pull out, okay? So they're gonna sit in there, and your body will absorb it eventually. And they're just gonna float there, you know, against the muscle, and you're not gonna see it through your skin anymore. It's cut, it's gone, goodbye, finito, right? And when the patient is laying down flat on the table, all that cellulite, you don't see it really anymore. So they have little rings around that they've drawn, and there's a light on this that they could see underneath the skin. And when they go in there and they clip it, they go back again underneath it to sweep it. And if it's a clean sweep, it's gone. Patients get marked standing up. So all these rings here on the booty cheeks, that's all the cellulite dimples. Sarah, the PA here, is clipping at all those. So when there's tug back, she's got to go back underneath there to have a clean sweep. So right here, you're gonna see it. She goes under, there's pull. She goes under here another time, pulls back with a clean sweep, and that cellulite is gone. An Avéli procedure is going to take about an hour long, and of course it's going to depend on how many dimples you have that you want removed. And your provider will let you know what grade you're at and how severe it is and how long it will take, but usually about up to an hour with anesthesia and prepping time and everything like that. And it's also a one-time procedure. So you should only have to go into that procedure just one time, and it should take care of it. Once those bands are gone, they're gone. Side effects. Side effects are going to include mild pain for the first 24 hours. After that, you're gonna eventually get some bruising, you're gonna get some swelling, you could get potentially some scar tissue development underneath, but hopefully your provider is going to be compressing you properly so you can minimize those chances of that even happening. There is a potential for a seroma. If you do get a seroma, it will get aspirated. No big deal, get it aspirated, get your compression on point, and side effects are really minimal, guys, from what I've seen. The most I've seen from girls that the feedback that they've given me is that their booty feels, if that's where they had the Avéli, the booty, the legs, wherever they had it, it feels like that they just had an intense workout, and that's what it feels. Just kind of sore, kind of like, you know, doesn't really last that long. So with the scar tissue, with those side effects, what you're going to want to do is you're going to get them massaged at the appropriate time though. Light in the beginning. If there is scar tissue development, that should be massaged out, and with proper compression after that, and you should be all good. It's a great procedure, guys. Ladies ask me when they will see the final results of the Avéli, and usually in the beginning when they're swollen, it's automatically the smoothness of the booty or the thighs is there. They'll just have bruising over it, but it's smooth because it's swollen, okay? So in about a month, that's usually when they'll see pretty much the final result of the Avéli procedure, and it is a local procedure. Do we look like we just came out of the rain or no? We look good, right? Our hair is wow. Why am I so much taller? Sarah is a PA. Sarah, what the heck does PA stand for?
PA stands for physician assistant or physician associate, depending on where you are.
Okay, she's fancy. So Sarah is the PA that does our Avéli here at Rand Plastic Surgery. So Sarah is going to tell us a little bit about local anesthesia and what the difference is with general anesthesia.
Yeah, so Avéli can be done usually under local anesthesia, which is done in one area. So you're not put to sleep. You're awake the whole time, listening to music, talking. It's a lot more fun. It can be done with a normal length needle, or we use a spinal needle, which is really long and really thin, which means you don't feel it as much. The most you feel is like the initial poke.
Okay.
And then for Avéli, we create some tunnels that we kind of, you know, use for the device. That way it's numb when we're going to each of the marked dimples. And once that area is numb, we go really slow. So that way you don't really feel it that much except for that initial poke.
Oh, okay, so there's actual tunnels that you go to the rings. So you're not just fishing around in there, you're actually going through. Oh, okay.
Yeah, that's how you're
I didn't know that.
everywhere.
Thank you.
Yeah. It can be done under general anesthesia, usually as an add-on to another plastic surgery. And that's really quick too, but usually under local.
Okay. Is it more common right now to do it as an add-on, or are people just doing it separate? Like at least for here in Chicago, like at Ram Plastic.
I think most people are getting it done afterwards, on its own, after they get things like a BBL. That's only because with Dr. Zizi, he knows that the more fat that you have in your booty, the more cellulite might develop.
Facts.
So you sometimes want to wait until after you get a BBL, after you're healed, and see if anything new pops up, and that way you can get everything instead of kind of chasing it.
All right, Sarah. People want to know, how safe is Avéli?
It is very safe. This is because it's done in this subcutaneous layer of tissue, which is just below the skin layer. So we're not going super deep where we can, hit major blood vessels or anything like that. So that's why the side effects are pretty minimal with the bruising and stuff and swelling. There's always risks of things like infection because we are, making a tiny, tiny incision in the skin. But that is, very, very low risk.
Hi, Sarah.
Important question. Are there any contraindications to Avéli?
There are a few. People who are currently pregnant or breastfeeding shouldn't be getting Avéli just because, there's always that risk of like lidocaine and stuff like that. And anybody who has coagulation medications, which make you bleed more. Anybody who has bleeding disorders, uncontrolled hypertension, uncontrolled diabetes, somebody who's an active skin infection in the area that we're treating, and anybody who's had surgery within the last 6 weeks, they shouldn't be getting Avéli either. We have to let areas heal before we do another procedure.
Good call.
Any just open lesions, obviously things in the area, actually in the area that would prevent us from doing a good job.
All right, you heard it from Sarah. Sarah the PA. All right, Sarah, who is an ideal candidate?
Oh, are we recording?
Yes, we are. All right, Sarah, who is an ideal candidate for Avéli?
An ideal candidate for Avéli is anyone with a BMI less than 30 who has mild to moderate skin laxity and dimples on the buttocks or the thighs.
This is not an interesting question. It's not, but what do you think the correct way to say Avéli is?
I think it's Avéli.
It's Avéli?
But apparently some people think it's Avéli.
Avéli? Avéli? Avéli?
Mm-hmm.
I'm going with Avéli. That's what I'm going with. Okay.
Sounds better.
All right, that's all I got.
Okay, thanks for having me.
Anytime, boo.